So, as someone that promotes anti-fragility, I'm generally agnostic to the debates about sleeping positions. So, whether people sleep on their back, sleep on their stomach, sleep on their side, I mostly don't really care. As long as you get good, high quality, deep sleep, then I think that outweighs almost anything you could do from a biomechanical standpoint. However, I will talk about this one sleeping position because overwhelmingly working with patients with vertigo, this sleeping position tends to wreak havoc on a lot of people's necks and causes a lot of neck pain for them. And that is with this head upright sleeping position, which a lot of people will do when they have vertigo, especially positional vertigo. So if you have BPPV, when you sleep on your back or on your side, sleeping on a particular side will cause those crystals to start moving, which gives you nystagmus, will give you that sense of that whirling sensation characteristic of vertigo. So many patients will actually resort towards sleeping on 4 or 5 pillows, or they'll get their wedge into this upright head position, and that will actually alleviate them from that vertigo problem. But the side effect from that is that many of these patients will actually go on to develop neck pain, which can actually kind of confuse the diagnosis because patients with neck pain and dizziness can often get misdiagnosed with cervicogenic vertigo, even though it's probably positional. If you have something called intractable BPPV, then there's some randomized studies that suggest this head upright sleeping position is probably going to be good for you in the long run. So that is something to consider if you get the Epley maneuver or one of these other positional maneuvers and it doesn't get rid of it and you have to keep on doing these procedures, then sure, sleeping head upright is probably going to be the best move for you. However, that isn't most people that have BPPV. Most people that have BPPV, if we do the Epley maneuver with them a few times, it actually gets rid of the problem, and we want people to actually resume sleeping on their back or on their side as soon as they can. And I bring this up because there's a lot of people that actually develop a fear of sleeping on their back once they have BPPV because the fear of triggering vertigo is so overwhelming that they would do anything to avoid it. I bring this up because I consulted with a patient that had BPPV on top of having cervical instability. So they were sleeping in this upright position, but it was wreaking havoc on their neck that's already a little bit sensitive because they have hypermobility in their neck. Just the simple fact of having that patient go back towards sleeping in a normal position actually reduced their neck pain about 50% before I even touched them. And no, I don't have any good studies that I could point to that suggest that sleeping upright is bad for your neck, but I think we have a lot of anecdotal evidence from people sleeping on airplanes, sleeping in cars, and sleeping in these upright positions at night that gives us an idea that there is a subset of patients who do sleep in these upright positions that are going to have an increased risk of neck pain from doing these types of behaviors.